Well, good afternoon, everyone, and thank you so much for taking the time to join today's discussion with Senator Bob Casey. The purpose of this call is to allow for the opportunity to hear from our panelists, which include medical experts and trusted community leaders, to talk about the importance of vaccine education. The senator and his guests will talk about concerns they're hearing from members of the local Latino community in Reading and Berks County, as well as discussing strategies and messages that could build trust in the vaccination process. Again, I'd like to thank our panelists for taking the time to join us today and all of those who are listening in. First of all, my name is Connor Kapora, and I'm the Lehigh Valley Regional Manager for Senator Casey, and I will facilitate today's call. Also joining us today are Doug Hartman from the Help Committee, Aisha Johnson, the Senator's National Press Secretary, and Sandra Garcia, Senator's Regional Manager in the Harrisburg office. And the panelists on today's call are Michael Toledo, President and CEO of Centro Hispano Hispanic Center of Reading and Berks County, Dr. Luis Murillo, Family Medicine Specialist at Reading Hospital, and Dr. Olubunmi Ojikutu, the Chair of the Department of Pediatrics at Reading Hospital. And in a few seconds, I'll turn the call over to the senator who will deliver introductory remarks, and then we'll hear from our panelists. But first, a quick note that this is being recorded, and we're joined by members of the media. After each panelist provides their remarks, we will open the call up to reporters for a Q&A. But at this time, members of the media will be invited to ask questions afterwards, sorry. But at this time, I'd like to turn the call over to Senator Bob Casey. Senator.
Okay, Connor, thanks. And I want to thank everyone for being on the call. This is a critical time for our country and our Commonwealth, because even as we have 2 vaccines available, we still have a very high case number and extraordinarily high death number, both across our country and across the Commonwealth. We know that as we stand today, over 865,000 cases in Pennsylvania, cases of COVID-19, over 22,000 deaths, and that number will get to 23,000 very soon. Just to give you a sense of the scale, the enormity of that in a historical sense, when Pennsylvanians fought in World War II, the killed in action number was nowhere near 22,000. We had in the high teens for the greatest military conflict in world history. We have more deaths now from COVID-19 in Pennsylvania than we had killed in action in World War II. So even as we have new tools to fight the virus, we have a long way to go. We do have 2 vaccines that can protect against the disease. And I know that there's often, and this is often the case, but I think even more so of late, often confusion and unfortunately a lot of misinformation that comes from a lot of different places. Sometimes misinformation from Washington, misinformation from federal government officials, misinformation on social media, all kinds of misleading information. I think at the national level, that's not happening now. President Biden and his team are providing consistent, reliable, accurate, science-based information. But unfortunately, there's still a lot of confusion out there. So naturally, people have questions, and that's why we have this call today for experts to share their knowledge and to have your questions answered. First of all, we want to make sure that we remind everyone when you're eligible to please get vaccinated and to do everything you can to protect yourself and your community. We know that even after you get vaccinated, but especially before there's an actual vaccination, it's important that we all continue, that all of us continue to take the steps that are necessary to wear a mask, to wash our hands, and to practice social distancing. So we have a long way to go, but fortunately we have some light at the end of the tunnel. But the unfortunate part is we're still getting information that's not accurate. So today we wanted to consult with folks who know the right answers and can give us good guidance. So we're grateful you're with us today, and Connor, I want to thank you and the others for arranging this call.
Thanks, Senator. And next we'll hear from Mike Toledo from Centro Hispano. Mike, you and your staff have been working to spread awareness about the vaccine and testing. Can you talk about why Centro Hispano is so committed to the effort of testing and vaccination and what you're hearing from folks in the community?
Sure. And again, we want to thank the Senator and the team for wanting to partner with us to speak on such an important topic as this. Again, at the Centro Hispano, we are servicing a great many of vulnerable families in the greater Reading community, and the importance of being able to share accurate, up-to-date, and correct information to the members of our community is of the utmost importance because of the fears and concerns that are out there as it relates to taking the vaccine and what would it mean in taking the vaccine. So the Hispanic Center is strongly encouraging and endorsing our community to, when the time comes where they are eligible and able to get the vaccine, we are asking our community members to please do so. In doing so, you're not only helping yourself to protect yourself, but protecting your loved ones, protecting your neighbors, protecting those who you work with, as we all do our part to help prevent the community spread, along with obviously making sure that we're following the social distance protocols that go along with the vaccinations that are available. Now, at the Hispanic Center, we were fortunate enough to be able to partner with one of our community partners, the Berks Community Health Center, that last week had some doses that were available to our staff who are working every day with vulnerable seniors that are 65 years of age and older. So members of our staff, including myself, were able to have the first vaccine dose. And just my personal experience for people that are afraid of getting the shot, I will tell you that for me and for my staff, in talking with them, it was very similar to receiving a tetanus shot. Again, it was, you have the shot, and again, there were no reactions or no kind of concerns afterwards. I know staff talked about having a little bit of pain in the arm that the shot was taken in, but that's to be expected. And the reality is that anytime we introduce a new medication or a new vaccine to the body, again, if you're feeling achy or a little bit of a headache, that's really a true sign that the vaccine is working, and that the body is working to increase and enhance your protections against the vaccine. So again, in terms of our experience at the Hispanic Center, for those who were fortunate enough to be able to get the first vaccine, everyone again is feeling good. Again, the only concern expressed was just the arm being sore for a day and a half. But I would rather take a little soreness on the arm for the added protection of again, the COVID virus and what people are suffering and are dealing with, those that are not being vaccinated at this time. So kind of that's what we have to share at the Hispanic Center, and happy to answer any questions at the end of the call for anyone that has any questions for the Hispanic Center. Thank you.
Thanks, Mike. I appreciate it. And next we'll hear from Dr. Luis Murillo. Dr. Murillo, could you share more about the vaccine and the safety of this vaccine for those listening in?
Sure, and thank you so much for giving me the opportunity to share a little bit with the community. I'm going to review 4 questions that I hear a lot, either from my patients or just in the community about the vaccine. The first question is, what are the vaccines that are available? Well, we've already kind of alluded to the fact that there's 2 vaccines that are right now in circulation. They're the Pfizer and the Moderna vaccine. The way these vaccines work are by a mechanism called mRNA. What that means is RNA is essentially a little instruction booklet for the body to be able to make a protein in the virus. What this does is the body is able to recognize the virus and then produce antibodies against the virus. So what this means is if you're out in the community and you get exposed to the virus after getting the vaccine, the body essentially says, hey, I've seen this before. I'm not going to worry about it. I'm going to put the antibodies to actually help you not get infected. So that's how the vaccine operates. It's important to remember that once the RNA is recognized by the body, it breaks down and the body gets rid of it. So it doesn't hang around for a prolonged period of time once the body gives you the antibodies. It's also important to remember that this is not a live vaccine. And what I mean by that is you don't get COVID-19 from getting the vaccine because there's no live virus. This is all a way for the body to be able to generate antibodies with the instruction booklets that's delivered by the RNA vaccine. The efficacy for the vaccines, we're seeing Pfizer is about 95% and Moderna is about 94%. So that's pretty outstanding in terms of being able to provide you protection against this virus. The second question I get are, why are these vaccines approved so quickly, and is there any safety shortcuts that were taken as a result of that? Well, I'll first say that mRNA vaccines are not a new concept. They've actually been researched for decades, but just now, because of the emergency that we have with the pandemic, they've come into the limelight. When vaccines go through an authorization process, they can take years, and the big reason for that is because of the money involved. So drug companies will often pay millions of dollars to get a vaccine passed, and they go through the process very slowly because they want to make sure it's effective for their benefit so they don't waste money on making it. What was different about this vaccine was that the government recognized that this was an emergency, and they helped fund this vaccine to be able to be created faster. So they gave the drug companies money to produce things so they could put all their resources into developing this. That's why the vaccine was made so quickly. There were no shortcuts to safety, to FDA standards. It was just that the companies had their undivided attention on these vaccines because of the state of the pandemic and the emergency that we're in right now. The third question I get are, what are the side effects? So we've already alluded to some of them. I feel that as physicians, it's very important for us to be transparent with our physician or with our patients so that they know exactly what they're going to be getting and what to expect. So according to the CDC, about 80 to 89% of people who receive the vaccine will have what's called local site pain. So what I mean by that is pain, swelling, or redness where the injection goes in. So again, if you're going to get the vaccine, which I recommend you do, you're highly likely to have some soreness or stiffness in the arm, like Mike was talking about. About 55 to 83% of people have what they call systematic symptoms. So what I mean by that are things like fever, fatigue, headaches, some chills, some muscle aches, and joint pains. So a lower percentage of people get these side effects, but these are more common after the second dose of the vaccine. Symptoms usually occur about 1 to 3 days after the vaccine, and it will only last for a few days. So those are the numbers on the side effects that people have experienced with the vaccine. The final question I'll address is, what was your experience with the vaccine? So as a physician, I did receive the vaccine, and my wife is also a healthcare provider, and she did as well. And I can say that we were part of the 80 to 89% of people who got the sore arm, and it was essentially just that. My son couldn't jump on me that evening. I couldn't play with him as I did, but I still had good operation on my arm. Nothing was major or severe, just a little bit of soreness, and it went away within 1 or 2 days. After the second vaccine, I had a little bit of a chill, nothing major. My wife had some headaches, but again, we were able to continue on our daily routine. We had no major changes to our life, and symptoms went away on their own. I didn't actually even have to take any Tylenol or ibuprofen. That's how mild the symptoms were. I'm now about 2 weeks since I received my second vaccine, and I continue to feel well. I don't have any major side effects, but I do feel grateful that I got the vaccine, both because now I can protect my family, the patients that I care for, and the community that I live in. And for those reasons, those benefits far outweighed any of the minor side effects that came with the vaccine. And that's why I highly recommend my patients to get it and to take one step forward into ending this pandemic for good.
Thank you, Doctor. Next, we'll hear from Dr. Ojikutu. Doctor, could you talk briefly about what it's been like as a provider on the front lines and what folks should expect when they get their vaccine?
Thank you. And thank you to everyone on the panel today. And thanks for allowing me to have a chance to be a part of this discussion. I also a healthcare provider. I'm a pediatrician. So I was particularly interested because we are in the business of seeing children during the ages where they are being vaccinated. So our offices are very used to answering questions about what parents should expect about vaccines, what our patients should expect about vaccines, how they expect it to work, what is related to the vaccine, and what is actually your body's response to it. We're also fortunate in this particular pandemic that the children's reaction to COVID has not been as the adults' reaction to COVID. So children are getting COVID, but we're learning that there's probably going to be parts of their anatomy, especially in the younger ones, that helps to temper the initial reaction to it and helps to decrease their chances of spreading as much as an older and a bigger person, taller, older, and a more adult body can get. And that's probably all contribute. And then we're also suspecting that the fact that they're in the age group where they are getting vaccinated is probably helping their immune system's response, where the whole idea of a primed and immune system that's alert and attentive, that's already the story of a child. So until we answer and know for sure which parts of this at play, as responsible healthcare providers, you're not going to see us jumping in front of the TV screen and claiming that that's what it is or putting it into the literature. We're going to follow this so that when we do come and report to our communities and our families that this is why it panned out this way in children, we're sure that we're giving you the most accurate information we have. That's also one of the reasons you're not hearing about vaccinations for children at this time. As in some states in the US and different parts of the country, studies have started in vaccination trials for children as young as 12. There's none going on in the state of Pennsylvania as far as I know, but all those steps are going to proceed and be carried out safely before recommendations will be made regarding vaccination for children. Today, I would like to share what it will, and then before I go that, I was privileged also to get the vaccine. I've gotten 2 doses of my vaccine. To add to that, what Dr. Murillo says, most of the time when we have a vaccine, like a 2-dose vaccine like this, it's because the first time your body sees the first dose, the parts of your immune system that get called into play will get called into play up to a certain point. Right? In these cases, we think you're about 30, well, studies are showing about 38% to 50% protection with the first dose. And then you give that second dose, and then we get up to those 95 and 97% protections like Dr. Murillo talked about. You might have read in literature that the way this particular set of vaccines is going is that it is better to use the vaccines you have available and give somebody 2 doses as opposed to just giving a whole bunch of people 1 dose. Remember, the goal here is to start growing this pool of people who, if they get exposed to COVID, are not going to get as sick from COVID, therefore will not shed it to other people, will not themselves end up in hospitalized, needing ventilation, or suffering the unfortunate outcome of death. So for you to start growing that pool of people, we need to get them 2 doses of the vaccine. That's why you're seeing that being the plan that you're reading about or you're hearing about in literature. If it's your turn to go for the vaccine, you'll probably be registered. When you get to the site that you're going to, you'll be asked some pre-screening questions. Questions such as, have you had any other vaccine in the past 14 days? We want to be sure what's causing what's not causing what. Questions about your past medical history, such as if you've had a severe allergic reaction to other vaccines. People who tend to have severe allergic reactions, it lets us know to watch them closer or to take a closer look at what they reacted to see if it is safe or not for them to get this vaccine. Questions. So we'll go through a short pre-screening, then you'll be moved along and given your vaccine. Then you will be watched for 15 minutes or 30 minutes, depending on what your past history has been with your health history or how you've reacted to vaccines. Then you will be rescheduled for your second dose, and then you'll be given a card that looks very much like this. It's your COVID-19 record card. And the date of your vaccine and what kind of vaccine you got will be put on it. The appointment for your next dose will be put on it, and you will be reminded to please bring this card back so that we can complete that information on it. And then you'll be given instructions on keeping the card. You'll also be given some kind of instructions on what to expect over the next few days and how to contact your doctor. There's also on the card and on the day of, you'll be told about some websites you can record on or report your symptoms to if you do have side effects or any symptoms, no matter how minor. That helps us to give you accurate information like we're sharing today. What's minor, what's major. It helps us to really know how this is going and to be more accurate in our reporting at this point. So that's what that process looks like. Now, in terms of what happens when people get vaccines, I'll tell you, our little kids, you know they're going to cry, you know they're going to scream, so you have your bribery ready, whether it's a sticker or a lollipop. Our teenagers tend to faint. They want to hold their breath, they get all anxious, they get panicky, and when they get their vaccines, they hit the ground. And then if they're of the right age group, they put all the drama involved in it. We have learned that they do not mean to alarm anybody. It's actually a natural response that people have when you tense up, you hold your breath, or if you're a person who starts to breathe fast. So signs of anxiety sometimes are mistaken as a reaction to the vaccine. That's part of the reason we have healthcare workers who are educated on this, and that's part of the reasons we're telling you this now. I know myself, I know how I would react if I'm anxious. I know my sisters, I know my mom, I know how they will react when they're anxious. So I would have that discussion with them, and we make sure we're seated. We make sure people aren't standing, like all the things that we've learned from how people react to vaccinations. We put that in place in this process to educate you ahead of time and put it in place on the day of to limit the chances of natural reactions being misconstrued as vaccine reactions and letting that scare people off. We don't want you to be scared off. We want you to get your vaccine. We want you safe for yourself. We want you safe for your household. We want you safe for your communities. We want to get past this together and still have you present and accounted for at the end of this.
Thank you, Doctor, and thanks to all of our panelists. And at this point, I'd like to turn it back over to Senator Casey for any questions you might have for the panelists.
Well, thanks, Connor. I'll start with Dr. Ojikutu and Dr. Murillo on something that I alluded to earlier and is, I think, evident from a lot of the data we have, not only about COVID-19 and the disproportionate impact it's had on Latinx communities, Hispanic Americans, communities of color generally, higher case numbers by proportion, higher death numbers, and frankly, the same prevails before the pandemic. Higher percentage of Americans living in those communities who don't have access to healthcare like some other Americans do. So for lots of reasons, there is misinformation or lack of information, and both doctors spoke to that. I guess I would ask the doctors, I think even with a change in Washington where I think you have an administration now that is providing, as I mentioned earlier, accurate, reliable, scientifically based information. But even if that goes real well, that's not enough, because most people are not going to get all their information from any government, any level of government or any government official. I wish it were otherwise. I wish there was a higher confidence in government, but there isn't. So even when a federal government entity or official or state government or county or municipal government, even when they're providing accurate, reliable information, that is not nearly enough to deal with this problem of misinformation, because there's a lot of other noise, a lot of other outlets out there that are providing misleading information. So I'd ask both doctors, how do you provide accurate information, or how are you working to share that accurate information? And then a related question about what are the trusted resources that your patients will trust at your recommendation? Is it someone in the community that they would turn to, even in addition to yourselves, or is it some other trusted resource?
So I think one of the most important ways that we've targeted this pandemic is through reinforcement of the same message. I think definitely the local government, the federal government has stated the importance of this pandemic. And as you mentioned, people don't get their news from all the same outlets. And so this is the place where people like Mike Toledo, Centro Hispano have done a wonderful job of giving us a platform, the physicians, to come on and address our community and talk to them. There have been similar types of these press releases or talks over the past few months where we've talked about the severity of the pandemic and how do we do the basic things before the vaccines, like social distancing, wearing masks. And then as we evolved and begun to have the vaccines, creating this place to kind of reinforce the message from the local and federal governments, from physicians in the community, whether it be from our hospital or Berks Community Health Center, to kind of hear in our own words what we're seeing and the importance of mitigating these risks. And the pandemic, I think, has been very helpful. And then I think in terms of who people are getting their information from, I think their physicians are one source, but I think, people's pastors, people's, their grocery store people they go to, their pharmacists, their friends in the community, these are all people that they get information from. And I think people make a decision based on kind of the collated consensus they get from everybody. So I think that having these platforms where we can reinforce this message and talk to as many people as possible to get people on the same page so that the community mindset is the same has been helpful, and I think will hopefully help us to get out of this pandemic sooner than later.
Mm-hmm. Dr. Ojikutu?
Yes, I have noticed that people are getting a lot of information from social media outlets, and there's this group this phone messaging called WhatsApp that if I count how many messages that come to me through the day from different chat groups, it's pretty impressive. So I don't think we can undermine or understate the impact of technology and social media and instant communication and that way that spreads information in this case. I think it's enough to have the facts, it's enough to have the pandemic, it's enough to have all the realities. Then you compound it. And sometimes the information that I'm getting is not even from the US, and it's spreading in our community. I'm like, yes, this is true somewhere, but it's not true here, and then the other thing I've noticed is, like, for instance, when medical professionals are looking at data and trying to interpret some piece of information, the first thing we look at is what's the source. And then the next thing we look at will be what are the numbers? Like, yes, this might show that 80% of XYZ population had the side effects, but if it turned out they only studied 50 people, that's not meaningful. You cannot use that to make any decisions or extrapolate from that. And then in our field, we are used to change. In the world of COVID, we need the information to change. When you first start correlating data and you've only tested 10 people and 8 of them are on the pathway to death, you can say 80% of these people are going to die. When you, over time, when you take care of a larger number and you can then start to tease out the fractions and the percentages, Then when you hear 80%, when you hear 2%, when you hear, so that kind of change in healthcare is not that somebody lied. It's not that somebody doesn't know what they're talking about. It's not flip-flopping. It's exactly the evolution of the process as we're learning through this together. And because of all the technology, we are definitely learning this together. So I commend everybody that says, I just want to learn more. I just want to understand. I just want to, I love those questions. That's good. Our role will be to share as much as you want to process. There are people who contact me and I said, would you like to see the data? Would you like to see the report I'm reading? If they do, I share it with them. I like to share websites like the Vaccine Adverse Effects Reporting websites or the CDC links that actually show the percentage of people that are having a side effect or are coming up tested positive, or, you know, I like to show them links to that. I like to give the Department of Health website. I think the Department of Health website has evolved beautifully during this process. If you're just looking to see graphs on how your county is doing with testing, on how your county is doing with hospitalizations, on what death rates are, on what recovery rates are. They're actually showing that they're giving it in words, they're giving it in charts, they're giving it in picture forms. If you're a school district and you're trying to see how to interpret testing, when your school needs to shut down, what percentage of students are being impacted, they've gotten that level of detail on that. So for Pennsylvania, I particularly like that website. The CDC website is my go-to, and I don't just say go to the CDC. If someone directly gets in contact with me, I take them a step further and I try to dial down and show them how to navigate the CDC website or give them a link. And I'll tell them what they will find. And then I give them an idea, if you're looking for more, how to kind of navigate the process, kind of start teaching them to responsibly feel comfortable with this website. For people looking for information on pediatrics, I like the American Academy of Pediatrics website. The link for parents is the healthykids.org portion, but a lot of times I refer people to their pediatrician. And I will give them an idea of what the trend is, but really refer them to their pediatrician for more information. I must commend Mike and his group for holding a platform like this. I must commend you, Senator, on taking the time to continue to have these kind of town halls through the community. I am grateful to the schools that reach out to us and say, we have a few questions for you. I'm grateful to teachers, to churches and places of worship that reach out to us and say, hey, we're hearing that this masking thing might be not as accurate, the percentages I'm seeing of this. How do you make sense of that? Those are not bad questions to us. That's like an invitation for a discussion. And we give them the information. People who say, I don't want to get the vaccine yet, I'm scared, I just want to wait. My next question to you is, tell me more about that. There is a reason. There's a legitimate reason they have. So I kind of tried to be patient and to listen, which means it takes time. So all the healthcare providers are doing the work and taking the time and trying to get to the bottom of what the question or the hesitancy is. And we'll tell you what we have. And we are not shy in healthcare of telling you we don't know, because we live in a research environment where the answer might be, for today, we don't know. The goal is that in a few weeks, we do know.
Yep, that's great. And a lot of good resources there. That's the tragic irony. There's a lot of good information online, and there's also a lot of bad information online as well that misleads people. But Mike, I was going to ask you both about this misinformation issue, which I'm sure you may encounter in your day-to-day work, but also what's the best way for us to convey the message about getting vaccinated? What's the best way for not only for us, but for organizations like you to make that case?
I think what's important, Senator, is that we have to be consistent. We have to be consistent with our messaging. At the Hispanic Center, we're utilizing multi-platforms to get the message across. whether it's our social media platform, which we've heard earlier, people are going more and more to for information, or through our radio platform, our radio show, or our television show on BCTV. You know, we have so many community partners, and we're seeing that here today with the Reading Hospital, the Centro Hispano, and others, where if we can collectively be consistent with our messaging as it relates to the importance of the vaccine, the importance of practicing social distancing, it will begin to resonate. It will begin to be locked into the minds of those families that we serve. Because the reality is, the families that we serve are those that are most vulnerable, and they depend on us. They look at the Centro Hispano as an anchor organization in the community that they can trust. And with that comes a great deal of responsibility. The same with the places of worship, the same with community benefit organizations like the hospitals, the community health centers, other agencies like the Olivet Boys and Girls Club and other organizations in our community. It's these organizations that are on the front lines of working with the families, the seniors, the children. If we can continue to be consistent on the messaging of how important it is, and that the sooner that we all are able to get the vaccine when it becomes available, the sooner we'll be able to get back to some sense of normalcy in our community. And I think we all want that. Everybody wants to get back to some sense of normalcy. And it's just important for us to continue to be the providers of information that our community needs, and to break down those barriers that you mentioned. You know, again, the barriers of language, the barriers of transportation to be able to get the vaccine. That's where the Hispanic Center plays such a critical role. You know, the Hispanic Center is a local affiliate of Unidos US. And across the country, Unidos and the Hispanic Center is going to be focusing on a marketing strategy to make sure that our community understands the importance of getting vaccinated and what it means for their family, what it means for the neighborhood, what it means for the community. So it's all hands on deck, Senator Casey. And again, we're committed here locally in Reading and Berks County to deliver this message of hope and this message of getting vaccinated so that we can, again, do what we can to keep our community and keep our families safe.
That's great. Well, I know we got to turn to press questions, and of course, folks who might have some additional commentary before we wrap up. Obviously, we welcome questions from the press for any one of us. In terms of vaccinations, you're probably going to get more information out of our guests, maybe especially the doctors, but certainly any questions for any of us are appropriate. So why don't maybe I'll turn to Connor and Aisha, and then we'll see where we are with time after that.
Yeah, I'll turn it over to Aisha to take questions from any of the press that are on the line.
Thank you, Connor. So at this time, members of the media can ask questions of Senator Casey and our panelists. To ask a question, please click on the raise hand button, which you can find in the participants panel via Zoom. This will allow me to unmute you. When your question has been answered, please click the button again to put your hand down. I will now give a brief pause to see if we have any questions. And our first question is from Tim. We're going to unmute you, Tim, if you can tell us what organization you represent. Tim, can you hear us?
Sorry about that. Can you hear us now?
Yes, we can hear you, Tim.
Okay. WFMZ News. What specifically is being done to help seniors get access to the vaccine specifically? Here in PA, we're still vaccinating tier 1. So how instrumental is it to get seniors vaccinated, and what's being done to help them have access to the vaccine?
Well, Tim, I'll just answer preliminarily because I think the doctors will have more information. But number one is the state is in the process, as you know, of taking what has been distributed to the state and getting that out. There's been a concentrated effort to focus on seniors in long-term care facilities and seniors more generally. But the most important thing that any member of Congress can do right now is to participate in and do everything we can together to get a relief bill done, because the president has proposed a bill. I know everyone is focused on the overall number, the $1.9 trillion, but the vaccination part of that bill alone would be transformative. By one estimate, $160 billion just to provide more resources for vaccinations. That will have a positive impact on seniors, people of all ages, so that we can do everything we can to meet or exceed the president's goal of 100 million shots in 100 days. I hope we could even go higher than that. But that's where things are now in terms of what's happening both in Pennsylvania and around the country. But we need a lot more in the way of resources. Every member of Congress should vote for this relief bill when we get to a vote. But in terms of the actual day-to-day reality for seniors, I think one or both of the doctors on this call might have more information.
Thank you.
So I can speak to the importance of getting seniors vaccinated. I think certainly we're seeing higher rates of bad outcomes with those as you get older. That's part of what the virus is doing to our community. And so we are definitely focused on getting vaccines into arms as soon as possible once we have the vaccines available. And I know that the hospitals in the area are beginning to rev up their apparatus to have that conducted in an orderly fashion. So definitely stay tuned as we work towards that goal. But I do think that once that machinery is up and running and we have the vaccines, getting the vaccines into the seniors is one of our high priorities for the pandemic.
And thank you, Tim. Did you have another question or is that it?
That should be fine. Thank you.
Perfect. Thank you so much for joining. Next, we'll go to Anthony. Anthony, if you can tell us what organization you represent, and we're gonna unmute you.
Yes, I'm with WITF in Harrisburg. So when we look at Latinos in the state and around the country, they've been disproportionately affected by COVID-19. And many Latinos also work in essential jobs. But essential jobs, agriculture work is down the line in the phases for PA vaccination. And I'm wondering if there are any efforts to reconcile this disparity where we see high infection rates among Latinos and in essential workers, but they're so far down the line in getting the vaccine afforded to them.
Yeah, just preliminarily, others may have other commentary, but look, this is one of the challenges we face, that when you don't have enough production for distribution, and that's been the case nationally, not only in Pennsylvania, or not only what lands or doesn't land in Pennsylvania by way of distribution, but nationwide. When you don't have the distribution that we need hundreds of millions more doses, for example, for the nation. When you don't have that, you're going to have a lot of people that are left out of the effort nationally to have more and more Americans vaccinated. So the administration has told the drug companies, the pharmaceutical manufacturers, to ramp up the manufacture of vaccines, and is using the full powers of the federal government to do that, whether it's the Defense Production Act or otherwise. But in the end, the most important thing the federal government's going to do in the next couple of weeks is pass a big bill and not a scaled back bill, but a big bill that will have a double impact if you wanted to break it down in just two categories. Number one, the virus, and number two, the economy, or number one, the getting vaccines and public health measures funded, but also getting relief to people that need it in the worst economy, certainly of my lifetime. So that's the most important thing the federal government could do. No matter what President Biden or his administration does to use executive authority and executive powers, they will be limited to a certain extent, not totally, but to a certain extent, if Congress doesn't get a relief bill done. I think by the early part of March is really the deadline. But there's no question that there are frontline workers, folks who live in communities of color, who are doing frontline work that have not gotten a vaccination and need to get a vaccination to do their work and to be safe. And that has to be a priority in terms of getting the distribution up. We got to produce a lot more vaccine and get it out there real fast to get it into the arms of more and more Americans across the board, but especially those who are vulnerable and who may be on the front lines.
And Anthony, did you have a follow-up question?
Yes, and this is, thank you, Senator Casey. This is for perhaps the healthcare workers and also Mr. Toledo. So there's been studies that show that around only 14% of Latinos show confidence in the vaccine. And I'm wondering if anyone can speak about any efforts that are happening outside of Centro Hispano, which has sort of served as a news agency to get this information out to Spanish-speaking folks. Do you know of any other efforts that are happening in Berks to build confidence among Latinos?
Well, I can speak to Anthony. I know that the County of Berks have begun to do some some press conferences and information that they're putting out there in the community with physicians from Reading Hospital, from St. Joe's, from the Qualified Health Center. And they have reached out to us in partnership with that to help, again, get that to those in the Spanish-speaking community. So I know the county is working in that space. I believe our partners at BCTV are also putting out information. So collectively we can be consistent with our messaging. Again, the hospitals can speak to the great work that they're doing as well.
Yeah, so I think this is definitely a call to action for the physicians in the area and has been a call to action in terms of the population health model of primary care. So really the work that we do as primary care doctors extends beyond the four walls of our clinic. And so while the primary care doctors in this hospital have worked to talk to their patients of Hispanic or Latinx origin, to talk to them about the safety on a provider to patient level, to bank off that existing relationship that they have with their patients to encourage them to have the vaccine. I think physicians stepping outside of their clinic and doing community work to also roll up their sleeves and get the word out to really help kind of generate this groundswell of this vaccine is something that's safe, this vaccine is something that we recommend, and this vaccine is good for our community. And in terms of the ways that we do that, I think partnering with people like Centro Hispano or the other agencies that are coming into Berks County to help facilitate that conversation is going to be paramount. And so I definitely look forward to, in the next weeks or so, working with these groups, working further with Mike Toledo to help do our part to extend the good word of the vaccine beyond our clinic and to work with our community partners to do so.
To add to that, so vaccination started sometime in beginning of December. And I think as a community, a healthcare community was taken aback by the amount of hesitancy we had towards vaccination. I know I was. And in between the time where you're catching up your breath to try to come to terms with that there is some hesitancy, and then you figured out how much hesitancy, and then we then have our supply issues starting to mount on that. So we are about a month into the reality of the situation, and starting to get numbers to support this feeling, and knowing that it's not just your feeling, it's actually legit. One of the things to tease out again in terms of data, right? The first thing we look at is the first tier that were vaccinated were healthcare workers. So, and the healthcare workers, to look at that is what percentage of those healthcare workers and long-term care facility workers, what percentage of those are what ethnic groups? If it turns out that the 24 million, so as of today's CDC updates on this vaccination data, the 24 million people that fall into that group, about 12 million so far have been vaccinated, right? If you then start looking at the breakdown of the ethnicities, you see that only about 50% of those that have been vaccinated were willing to share some ethnicity and other demographics. When you then look at what you have, if you then compare from the information we have, how wide is the disparity? And then you can start, as opposed to just throwing things at it, then you can really start honing down and going after, okay, here's what the problem is. Make sure that my solution actually fits where the problem is. So at this point, we're at the point where people like you who were anticipating this problem, you're actually ahead of people like us who are caught by surprise. Because we live in the hospital, we just assumed, we see the worst of it. So we just assumed as soon as this vaccine comes out, everybody is going to want it. We were actually thinking we were thinking we were perpetually going to have a supply issue. We wouldn't ever have enough vaccines to vaccinate fast enough. We did not we did not prepare for this much hesitancy. So all that is falling into place now. Now we know that, yes, it's not just that there's a disparity in vaccination, even amongst the people who should have been vaccinated and frontline health workers, that gap is starting to show. So this is the call to action, like Dr. Murillo said. Like this is, it's not just the members of the Hispanic community looking for us healthcare workers to partner with, is us healthcare workers looking for whoever we can partner with, who has access to the community members that are Hispanic and any other high-risk group. The language you will hear in the hospital is, find me the zip codes where our sickest and our most vulnerable are, and let's start matching our efforts to that. So that's all just starting. The planning is around that. The awareness is there. This kind of conversation, this forum, the outlet we have is perfect. If you're out there and you are established with communities where they're high risk, and you need to link with physicians or members of healthcare communities to come and start having small group discussions, please reach out to us. If you don't know who to reach out to, start with your PCP. If you're not sure if you have a PCP or someone that you know in your own personal small sphere, send out every hospital website at this point has information on COVID-19 question and answer, COVID-19, send your email responses to this, reach out there. If you're not sure beyond that, reach out to Mr. Toledo. The point of this kind of discussion that the Senator's office is organizing is to help us connect. So the shame will be in the next month if we're still having the same conversation, right? So this is all in place, and we're hoping that there's enough heart in every sphere of our community that we can band together and take the baton. I think the hospitals and the healthcare workers and the frontline workers have taken a lot of the hit in terms of who has been battling in-house with this the most. There's enough of us in the outpatient world. There's enough of you in the outpatient world. There's enough of us that can now partner and take that baton and use this time between when we're upping our supply levels to really go to our communities and say, we're listening. Ask us your specific question. I can probably give you some valid information on 70% of that. And then if you can live with the 30% that's unknown, join me and get the vaccine,
Thank you so much. Next, we will have one final question from Doug Graves. Doug, we're going to unmute you now. And if you could please start by telling us your media outlet. Thank you.
Doug, can you unmute? You're still muted.
I think you guys unmuted me by accident.
I'm sorry, go ahead.
Hello, Senator Casey. Douglas Graves with the Bethlehem Press.
Hey.
I'm in Lehigh County, part of Bethlehem is. We just recently had a death of a correction officer and a inmate in Lehigh County Jail. And the public is starting to express a little bit of serious concern about why the jails are not already receiving vaccines for the inmates and the prisoners. And the correctional staff. Can the federal government do anything to facilitate that and make it a little higher priority than it seems to be?
Yeah, Doug, I referenced in my earlier answer about the role of the federal government here. Obviously, when folks reference the Centers for Disease Control and Prevention and federal government agencies to provide guidance, that's what states are being. That's where states are getting their guidance in terms of getting distribution out the door and following the order of the order of vaccination. But the most difficult challenge we have, in my judgment, right now is not nearly enough vaccines. We need, as I said before, a couple 100 million more to be able to vaccinate folks in different categories, and certainly those in correctional institutions are part of that. It seems like every day there's a highlight of another group of Americans, or in this case, Pennsylvanians, who need to be vaccinated, and where the system has not gotten to them yet. A lot of that, I think, is being driven by the lack of resources, lack of vaccine, frankly, supply and distribution. But as I said before, the most important thing we can do is to appropriate money so that we can speed up vaccinations to get at least to the goal of what the president said, to get 100 million shots into the arms of people in 100 days, if not faster. So it's really a question of supply and distribution, I think, at this point. But you raise a very important point when you have folks that are in a community where there's a correctional institution and folks in the community are working there. It's akin to or similar to what we saw in long-term care facilities. You know that 40% of all the deaths in America from COVID-19 were in long-term care facilities. The deaths meaning even or in addition to the older Americans who have died in nursing homes because of the virus. A lot of the deaths are also from those who work in long-term care. And the same dynamic prevails in correctional institutions. So we have to do everything we can to devote the dollars, the resources, the supply to getting more vaccines out there and get the distribution moving as fast as possible. But I hear you when you highlight yet another category where the vaccinations are not happening fast enough.
Okay, well, thank you, Senator Casey.
Thank you.
And at this point, I will turn over the call back to Connor. Thank you.
Thanks, Aisha. Thanks to everyone who participated or asked a question, and to our staff that are on the line. But I will turn it over to Senator Casey for any closing remarks. Senator?
I want to start by thanking the folks on our panel. Mike Toledo, thank you for taking the time to be on the call and to share your perspective as a leader within the community. I can't imagine a more important job in this difficult time, when there is both a terrible pandemic, the bright light and hope of a vaccine, but still some problems with distribution, but also still some problems with misinformation or hesitancy. So I want to thank you for your leadership. I want to thank both of the physicians on this call, Dr. Ojikutu, and as well as Dr. Murillo, for providing their perspective and their expertise and experience. There's nothing wrong with any individual questioning or raising questions or demanding answers about the vaccine. And we want to make sure that folks get the information that they need so that when their turn arrives, that they will feel comfortable getting the vaccine. And that's why I think this panel of experts provided information that some people may not have had, or at least provided information about where you can get the answer, the resource you can go to. I wanted to add a few more to that list in addition to those that were provided already and those that we made reference to earlier. Also want to provide information about our office because if we can't provide information directly to you, we can certainly direct you to the right resources. Two ways, of course, of contacting us: through our website at casey.senate.gov, as well as our constituent service number, 1-866-802-2833. This is information that some people may not have, but we want to make sure that you have it. The Department of Health in Pennsylvania is also has a phone number. It's 877-PA-HEALTH. That's 877-PA-HEALTH, PA Health. Their website, of course, is health.pa.gov. So in addition to the information you heard earlier, that's information at the state level and through our office that provides accurate, reliable information, either directly in answer to a question or information about how you can have additional questions answered. It's very important that we give people the right information so that as they're making a decision about a vaccination, that they have the information presented to them. And obviously, until then, until you're actually vaccinated, even after you're vaccinated, but especially before you're vaccinated, the best vaccine is still the public health guidance that we've all followed: washing our hands, wearing masks, and making sure that we're socially distant. So we really appreciate this time and the information provided by our great panel. We look forward to continuing to work with folks to get people vaccinated and to get the information they need before they're vaccinated. Thanks, everybody.
Thanks, sir.
Thanks so much, Senator, and thanks everyone. That concludes today's call. I hope you have a great rest of your day.
Thank you so much, everyone. Stay safe.